My dad coached me ever since I can remember.
Outside corner for strike 3. 2 more strikeouts that inning, I believe.
I ended up getting Athlete of the Year for my senior year. And then that's when I kind of started getting noticed for colleges.
And there's a swing, 3 straight pitches. Strike 1, strike 2, strike 3, and that's the game.
I started playing college ball, and I played that for a year until the accident. Big SUV hit me. I hit a pole, and he hit me twice. I don't really remember anything until I was at the hospital. I thought something was wrong with my neck. They didn't really do anything at the hospital. I told them I was in a lot of back pain, and then they just sent me home. So then once I started walking more, I would bend over to get something, and I would be stuck. I couldn't move. Finally asked my doctor if she could please get me an MRI, and she didn't think anything was wrong, and I knew something wasn't right. It showed that I had a shattered L4 and L5 disc, and then my one above that was herniated. Oh, your back's fine, you don't need anything done, it'll fix itself, so let's start physical therapy, So I went to another back doctor, and then he goes, well, I can fix it, but we'll have to cut your back open, and you'll have a 1-foot incision. I mean, I was at the point I was just ready to give up. My friend actually went to Dr. Kremer for a surgery, and so she told me about him. And so I just called and made an appointment.
It almost breaks my heart to think that some of these younger patients are almost discriminated against because they're healthy. She had a trauma, she had an injury to her spine. And so what I'm looking for is a weakened joint, a loose joint.
They looked at my MRI, and he explained everything in detail to me, what I needed done if I wanted to have it done, what was going on, and how he would fix it.
This is a perfect patient for a minimally invasive, minimal fusion type of surgery. You see, not only does this unpinch the nerves at L4-5, but it restores the regional function to her spine. Her other joints work better, not worse, better.
And right when I stood up for the first time after my surgery, I could just feel feeling back in my legs. It was one of the greatest feelings. It was awesome. He wanted me to start walking every day, start off at 10 minutes, and I eventually got up to a whole mile without having to stop or take a break or anything.
She can get back on the field and not just compete, but compete well.
I go to the cage and I hit, and I went to a couple softball practices. I still have another year I could play in college, so that's definitely something I would really enjoy doing. Dr. Kremer, I mean, he changed my life for sure. If I did not meet him, I probably would have never got my back fixed. I can't thank him enough. He was awesome.